I'm Liz Darlison, Macmillan nurse consultant from the University Hospitals of Leicester, and it's from there that I and a small team of people run Mesothelioma UK, which is a national resource centre for this dreadful disease. Mesothelioma UK, it kind of just grew out of our lung cancer MDT as an idea to develop a resource centre for patients, and it's really grown now into quite a pivotal service that's depended on by patients, carers and healthcare professionals, I think too, and many other people within the mesothelioma community. In 7 minutes I was asked to try and capture and put in a presentation what this mesothelioma priority setting partnership means to the mesothelioma community, and in keeping with the whole tone of the adventure we're about to embark on, I thought best to go out and ask them. And so that's what I did. So as we go through the presentation, I think it's worth reminding ourselves that mesothelioma is not a disease related to lifestyle choice. It's an industrial disease, and many of those people that are affected were simply out earning a living when they were exposed to asbestos. And sadly, those of us that work with these people every single day are increasingly seeing people where that exposure was very, very casual indeed. It wasn't heavy exposure. We know that people often have a dreadful experience seeking out expertise and accessing treatment, and perhaps worst of all, in this world where we see amazing discoveries on a daily basis, the current standard treatment for mesothelioma is based on research that was published over 10 years ago. Everything thereafter is based on whether the expertise is available, individual opinion and cost. So we in the UK really, we have the highest incidence of this disease in the world, and it's increasing every year. We owe it to citizens of the UK to do something radical to help. And sadly, the asbestos story is shifting around our globe, and with it in time, the mesothelioma tragedy will too. So I consider that the UK and our NHS has a duty to lead the way in finding better treatments, better care, and hopefully a cure for mesothelioma. So I just sent emails out to the people that I'm in email contact with, and this is what they had to say. Mavis Nye is a patient. Mavis is an avid blogger. Do Google her and follow her blog. It makes very interesting reading. We need more research to catch up with patients like myself that are surviving longer than 3.5 years and find there is no treatment. John Whitfellham, he's lead lung cancer nurse in NHS Lanark, been involved in the lung cancer community for a long, long time. Mesothelioma is a disease which presents a significant symptom burden to patients. As a consequence, it also has an effect on family members of those affected. A rounded approach to research that includes a clinical research but also research that is holistic and patient and family centred is of great importance. The reality in the majority of cases is that treatment and care will have a strong palliative and supportive care focus. As a clinical community, we need to understand what patients and families need in order for us all to deliver the best care we can. Research is vital to this. Roberta Kelly is an IT manager from Northern Ireland, and she's carer for her father. The outcome for patients must be improved. This is such a devastating disease. We are crying out for a cure. Dr. Corinne Faber-Finn is a reader at the Institute of Cancer Sciences at the University of Manchester, an honorary consultant clinical oncologist at the Christie, and she's the chief investigator for the PIP study. I commend this new initiative from the NIHR. It should make a big impact on mesothelioma research. Jane Seabury is a retired teacher. She's a patient. She has malignant epithelial mesothelioma. My original prognosis was survival of 22 months. I am desperately hoping that research will dramatically improve my situation. Terry Rosamond, a carer. I really do hope that this project will provide the much needed research towards finding a cure for this disease so that other people will not see their loved ones fade away like I had to. Graham Sherlock Brown, patient, diagnosed in 2002. I am one of the few lucky ones to survive long term, but I still don't know why. This project at last gives me the opportunity to ask and get the answers to that question, hopefully to the benefit of every other victim. Jeremy Steele, co-director of Bart's Mesothelioma Research and consultant in medical oncology at St Bartholomew's Hospital. The Mesothelioma Priority Setting Partnership and Initiative is an exciting and important new project, as mesothelioma continues to be a huge issue for those affected and for all aspects of our healthcare system. Patients affected by mesothelioma continue to receive poor care in many parts of the UK. This is unacceptable, and the partnership should be instrumental in raising the profile of this still neglected group of patients. David Ardren, lay member of the trial management group for the PIT mesothelioma trial, and he works closely in consumer affairs in lung cancer research. The prognosis for mesothelioma patients is very difficult, and potential treatments such as surgery and chemotherapy are radical and have massive side effects. Quality of life living with mesothelioma is very poor and difficult for patients and their families. Extensive research to lessen this burden is vital. Mesothelioma is an environmental cancer, and it affects people from many walks of life purely by chance exposure to airborne contaminants. We need to take steps to prevent it wherever possible, but also to treat it more successfully when it does occur. Lynn Johnson is a patient. I'm lucky to have made 60, diagnosed in June 2007. My father died over 20 years ago at 59 from peritoneal meso and never saw his grandchildren grow up. I won't see mine grow up either. Research is needed now. Mr. Apostolos Nakas, consultant thoracic surgeon in Leicester. After years of nihilism, we have at last the opportunity to make a difference to the lives of people affected by mesothelioma. Robert Brown, patient, business consultant. In addition to an immediate increase in funding for mesothelioma research, I would also like to see hospital oncology departments more informed as to available treatments for mesothelioma patients. Interestingly, Robert lives in Bath, resides in London, and gets his treatment in Midlands. Laurie Casnallen, editor and publisher of the British Asbestos newsletter, coordinator of International Ban on Asbestos Secretariat, and I urge you to look at their website if you really do want to get a feel for the global burden of asbestos. It is long past time that the voice of mesothelioma patients is heard in the corridors of power. The James Lind Alliance initiative aims to facilitate this objective through a collaborative effort to define the priorities of patients, carers and clinicians. We wish all those involved the best of luck in this potentially life-saving exercise. Peter Robinson, a carer. This initiative will provide much-needed research and will provide hope to patients and carers affected by mesothelioma. Anne Nussey, a patient and also a teacher of the Alexander technique. Incurable is one thing, but when it's preventable, it's another. I don't want my husband to lose me to cancer. Exposure to asbestos can be prevented. What needs to be done to make this happen? Peter Lee, a managing director and a patient, diagnosed November 2011. At long last, this initiative will give hope to the many patients and carers. Richard Elsom, patient, diagnosed in March 2011, pictured here with his wife Jackie, his carer. Raising the profile of mesothelioma is the only way all universities, biotech and pharmaceutical researchers will fund multiple studies. About time. Mal Davidson is described by an inspiration to people who know him. He's a patient. These photographs were taken cycling in the Alps while suffering from mesothelioma. The funding proposal for research into mesothelioma must be very, very welcome news for patients, carers and families alike for this terrible disease. Gemma Walker, carer, pictured here with her children George and Charlie and her husband Colin, who died earlier this year. More research and awareness is needed to combat this preventable cancer that is destroying families. Victims and their families need hope. David Holroyd, I'm a 70-year-old malignant pleural mesothelioma patient diagnosed in January 2012. Malignant pleural mesothelioma cases from the direct exposure of asbestos workers is and will continue to reduce, but as the multiplicity of buildings, schools, hospitals, offices, etc., that we've used asbestos in age and degrade, then many of the UK population, in particular the young and the vulnerable, will be in danger of exposure to the fibres and subsequent disease. Malignant pleural mesothelioma treatment is an urgent problem. Please prioritise it. Alan Emery, patient. After working for 47 years in industry, why, after never knowingly worked with asbestos, has my life been devastated by this material? It is pleasing to hear that politicians and other institutions are making mesothelioma a priority. Hopefully with investment and research, future generations, my grandchildren, will have better protection. Dr. Robert Rintoul, consultant respiratory physician, lead clinician for thoracic oncology in Cambridge. I feel that the work of the James Lind Alliance in this area will be a vital piece of work in helping to set the research agenda for mesothelioma over the next few years. It will also help Mesobank identify the types of material required by researchers to answer the questions that they have. Dr. David Baldwin, consultant respiratory physician in Nottingham. Progress in treatment of mesothelioma has been slow. Establishing research priorities is essential. Graham Bancroft, patient with peritoneal mesothelioma. Parliament now looking at this could mean, to people living with this disease, a matter of life or death. Interestingly, it took him a year to negotiate funding to seek out expert treatment. Dr. Richard Booton, consultant chest physician and honorary senior lecturer in respiratory medicine in Manchester. Let's not presume that mesothelioma has defeated us and our patients already. The application of high-quality clinical care and research can transform lives. John White, lead lung cancer nurse specialist at Leeds and chair of the National Lung Cancer Forum for Nurses. There is finally an opportunity for key groups in mesothelioma to get together to identify and agree research priorities. As a health professional working in the field for many years, it is refreshing that a novel approach to achieving this is to take place, enabling me to address patients' and carers' concerns about the lack of research evidence available. Jeremy Goodman, husband of Angela Goodman and director of Leicester Dental Teaching Academy, married 42 years with one boy and a girl. His daughter was due to be married on Sunday, September the 29th, and his son gave birth to their first grandson on December the 1st. His wife died September the 21st. My wife Angela died because she gave her life to teaching. She died not because of lifestyle choices, but because the state built her classroom with asbestos in the ceiling voids, and then no one warned her of the danger this posed. The state, rather than remove the threat, chose instead to categorise this cancer as an industrial disease and pay compensation. My wife started treatment leading to a diagnosis just 2 weeks into her retirement. Within 12 months she was dead, having undergone radical surgery, followed by radiotherapy and finally chemotherapy in a desperate attempt to control the progress of the cancer. She and other sufferers deserve a better chance that only more research can bring. Professor Anoop Chauhan, Director of Research, Portsmouth Hospital NHS Trust and Chief Investigator for the Respect Meso trial. We must double our efforts to ensure every patient with mesothelioma has access to new treatments through high-quality research. Valerie Lay, a carer, her husband Brian died January the 29th, 2013. My family has lost a wonderful man prematurely to mesothelioma. He didn't work with asbestos, and we need to understand more. And finally, Jan Egerton, a patient, diagnosed in August 2004. Mesothelioma cancer is far from decreasing in numbers. Research on how to turn this from terminal to livable is imperative.